Hi, my name is Kate McMahon, and thank you so much for joining us today for What's Happening. I'm very excited to welcome back the leadership of the Alzheimer's Family Support Center of Cape Cod. Thanks for being here. I have You bet. I have Molly Perdue. She's the executive director and co-founder, and Melanie Braverman, who is also a co-founder, and she is the cultural director. Thanks for the great work that you guys do on the Cape. It's just wonderful. I've had personal experience with you. I've heard others' experiences, and it's such a big issue nowadays. So thank you for what you do. Now today, though, we're talking about a really cool event. But before we get to the event, would you all mind reminding the audience of the mission of the center?
The mission of the center is to provide an array of services free of charge to families who are navigating Alzheimer's or any related dementia disease, free of charge. And that is the basis of our mission. It's pretty simple. We offer a lot of different services, but the fundamental piece is that we want as many people as possible. There's an estimated 10,000 people living with some kind of dementia disease on Cape Cod in the care of maybe 30,000 unpaid family caregivers. So we want these services to get out to as many of those people as we possibly can, and free of charge.
Yeah, so Kate, one of the reasons why we got started is that, we had cared for my mom, and it became clear that the support we received from our community really made a difference, because we were living down in Provincetown while we were taking care of her. And at the same time, when I was working on my PhD, I was looking at best practices, trying to figure out what information was available for families like mine, dealing with Alzheimer's living on Cape Cod. And so the center, in all of its free services, is kind of designed to put those best practices, out into the world. So one of the things we know is that it's really hard to ask for help. So many people think, well, I'm not there yet. This is what we hear a lot of, is I'm not there yet. And the truth is, as soon as someone starts to have some cognitive decline, you can always benefit from a telephone call. So we want to make sure that people know that help is as simple as picking up the phone and saying, whatever issue you're trying to figure out there on your own, that there's somebody that's a professional that has training, that knows how to help you, give you a little bit of insight, or at least have a conversation with. And that's kind of the premise of the mission statement that Melanie was talking about, is that people become symptomatic out in the community, in their homes, while they're mowing the lawn, or while they're taking a walk, while they're driving a car, and nobody knows what to do. And people that are living with cognitive impairment, they need support as well. And many times, they don't have those conversations early on when they need to, because we want folks that are living with impairment to have robust lives, to have meaning, and to be able to be a part of their own decision making. And if you try and pretend something isn't happening, it's hard to be a part of things if you wait too long. So we just want people to know that there's a confidential, we're HIPAA compliant. We don't tell people about your business, but you can call, you can get some great help, and there's no barriers. We don't care about your insurance when you call us. We don't care about how much money you have, except if we're trying to advise you. And then, long-term care can be quite unwieldy in this country. So, there is some information we gather while we're trying to help. But other than that, we want it to be as easy as possible.
And I think it's interesting to let people know that of the estimated 10,000 people on the Cape living with these diseases, only half of them have been identified. And that means in our communities, we have a whole lot of people who are living without the benefit of any kind of support at all. And so, part of what's so great about your generosity, Kate, is that it allows us to get the word out that services are here, they're easy to access, they don't cost anything, and they're confidential. And so hopefully, and you don't, by the way, have to have a diagnosis to access services. So somebody could have not seen a doctor, not talked to a neurologist, and still benefit from the kinds of help that we provide. So it's a great service to us and to the community to be able to get the word out too, that we're here and that we can help, and it's easy.
What is really important for people to understand is oftentimes this is uncharted territory for families. They haven't had to experience this before, and so they're really not certain what is available to them. And you guys just fill that gap so nicely.
Well, they say you don't know what you don't know, right?
Right.
And I think in my experience of caregiving personally was kind of like that. Like, I didn't know what was coming next. I didn't know when my mother started to hallucinate what you should do, or I didn't know when she unfortunately went on walkabout one morning, or when she wasn't sleeping. And I think what we try to do is take our personal experience, take our professional experience, kind of put it together in a way that people can access it really easily, and try to help people have a little more stability during their caregiving experience. And also, I think the experience of our clinicians is that it helps people that are living with the disease not be so frightened, because it's so easy, because there's so many unknowns, that you get scared, and everybody's a little scared. So trying to deal with the uncertainty of Alzheimer's within the family unit is something that all of our people are trained and knowledgeable to address. And that can be really helpful, because if you have a little bit of a plan, you don't feel quite so scared.
Right. And a lot of that has to do with education. And I know that is one of the services that is really important to the center. And that's why we really wanted to chat with today, because we have a big event coming up at the end of August with Teepa Snow, who's an expert in this space. And can you share a little bit more with the audience about this very cool, one-of-a-kind, first-time event that you guys get to sponsor or share with our community?
Yeah, so Teepa Snow has been coming to the Cape on and off for quite some time. When I first started working at Alzheimer's Services, I met Teepa Snow at Christ the King Church, because Lisa Galazzi, who now runs the Housing Assistance Corps, she had brought her to the Cape. And what I loved about Teepa is that she's full of energy. She knows how to help people kind of understand what a person with dementia is experiencing, because she was a theater major. Not only is she an occupational therapist, but she, as an undergrad, was a theater major. So she's excellent in moving in and out of these roles and making it completely understandable and really hitting the lessons home. And what she calls her approach is a positive approach to care. And that was the other thing that I was struck with when I first met her, is that we so many times think about all the negatives, and here's someone talking about how do you approach care from a positive perspective and have fun with it, and make sure that everybody kind of knows how to move the conversation in a more jovial and in a more accepting way. And she's amazing at it.
I think one of the important distinctions that she makes in her training is that she moves it out of the caregiving realm and moves it into the, what is it like to live with this? How are we going to figure out how to live with this? In other words, it changes the power dynamic a little bit between the person who has the disease and the caregiver too, so that they're actually in this equal relationship. And your job is to figure out how to navigate this new cognition that the person is showing you. Mm-hmm. And so one of the really cool things about her expertise is she puts the behaviors together with what's happening in somebody's brain, so that the behaviors feel less personal and they feel less mysterious.
Right.
And then you can just get in there and start to figure out how to interact with somebody in a way that actually builds the communication. And then you're just in a relationship.
Yeah.
right?
Yeah.
And that's something she's really, really good at.
It is. Do you mind if I just share an experience that I had when I attended the event? I believe it was last year that was held at the high school. I was only able to be there part of the day, and quite frankly, I didn't know about Teepa Snow at all upon arrival. And I'm thinking to myself, oh, this, it's a sad subject, and so many people are experiencing it, and I don't know what this is going to feel like. Well, from the moment I heard her start speaking, her approach to sharing experiences and helping people understand the entire dynamic from the family to the caregivers to the individual that's suffering made it so accessible to me. And she made me laugh. It was, taking a subject that is very serious and oftentimes sad. And I just have to say the experience was wonderful. I also felt like, yes, it was a big group. We had 1,500 people in the audience. However, there was a connection that was made there that I seldom feel. So I just have to encourage our audience to make the time to listen to Teepa, because if nothing else, she'll make you laugh, and I know you will learn at least one thing to make your life better.
Yeah, thank you for that. She was phenomenal last year. She did such an amazing job, and we dealt with a lot of behavioral work that she had talked about. So what's great about Teepa is that she's going to be dealing with COVID-19, and the morning session is going to be about engagement and activity modification during COVID, and how to deal with infection control during COVID, and how to take care of folks and make sure they have good hygiene, but everybody's safe. And I think the morning session would be important for anyone that's taking care of somebody that has dementia or Alzheimer's. You're gonna say something?
I want to back up a little bit before we get too deep into the content and let people know that this is actually going to be offered on Zoom. So lest you think that we're going to put 1,500 people back in the high school.
Thank you for mentioning that.
This is going to be a Zoom event. It's going to take place on Saturday, August 29th, and it is a day-long event. It goes from 8:30 until 4:30 in the afternoon. But what we're doing is Teepa's offering 6 discrete hour-long sessions, each one covering a different aspect of dementia-related issues as they pertain to the pandemic. And in between each hour-long session will be more content that's provided by different people. Greg O'Brien will be with us again. We're happy to announce that Senator Markey will be opening the conference for us.
Wonderful.
Alzheimer's and dementia is a very big issue for him. He was a caregiver for his mom for a long time. And so he has offered to join us and say a few words at the beginning of the conference. So in between each hour of teaching will be additional content with breaks built in for people because it can be a long day.
Yeah, so we're really excited about the morning session. The afternoon, what's going to be, on the docket is tips for connecting via video chat and Zoom, because how hard is it now that this is how we communicate?
Right.
This is how you do your interviews. This is how, this is what we view on TV. And so many people, they just don't quite understand how to use those platforms. And she's going to try and teach everybody, people that have dementia as well as caregivers, how to do that better. Going to talk about ideas for engagement when you're distancing in your home and you're, you're not with your community entirely. You only have the video screen or the TV screen. So it sounds really exciting, and they're tools that we're all going to need in the next 6 months. I mean, this conference, I am hopeful nobody would want to even listen to it by next spring, because we're going to be on the other side of this with a vaccine. But until then, as I tell my caregivers when we're doing support groups, hey, we're going to be prepared. It's just, Noah got the ark. We're going to get Zoom going,
Right. Exactly.
Absolutely.
So this, So this event is, again, Melanie, you mentioned, it's Saturday, August 29th,
Mm-hmm.
and it's a full day event.
It's
And
a full
how,
day. It starts at 8:30 and it goes straight through until 4:30.
that's great.
And
And
the other aspect of it that I wanted to mention is that we also offer free continuing education credits for professionals. And this year it feels especially important because these folks have been on the front lines dealing with this stuff in facilities in almost impossible circumstances. And so for us, it's a gesture of giving back to that community, of acknowledging the difficult work, especially when families can't get into facilities. They have to stand in for families.
yeah,
And so we really want to honor that community for doing this hard work. We're encouraging certified nursing assistants who do a lot of the heavy lifting, whether in the community or in facilities, to be able to come on and participate in this. They don't require continuing education credits, but we know that everybody needs to have this training.
They require training.
And they do require training. So this is a
Right.
way for them to get it in a way that's easy, accessible, and free of charge. So we're really encouraging the professional community to turn out and take advantage of the opportunity. But we also really want family caregivers to get some of this education, excuse me, understanding that they're isolated in the home without benefit of day programs, et cetera, that they would normally be accessing. And so they really need this information too.
So for
wonderful.
social workers and RNs and activity directors, and mental health professionals, they'll get 6 CEs. But we're also printing out certificates for the CNAs. So they will get a certificate of completion, once they finish. So we're really excited about that. We had, a lot of CNAs attend last time, and I know that they don't need the CEs necessarily, but they do need hours of training. And there is no better trainer in the entire country, maybe internationally, than Teepa Snow. So she always makes it fun, and the time goes really quickly, and you learn so much. So
It's great. It's great.
Yeah.
I'm looking forward to attending. So again, Melanie, can you share? It's Saturday, August 29th.
Saturday, August 29th from 8:30 to 4:30. It's really easy to sign up. You go to our website, it's alzheimerscapecod.org. And the hardest thing about that is spelling Alzheimer's. So let me do that for you now. It's ALZHEIMERS.capecod.org, alzheimerscapecod.org. And on our site, there's a button to get to the conference, and from there, it'll take you right to the site to register. We do need people to register to be able to participate, and that's all it takes. Once you sign up on the site, you're in. We'll be sending out reminders, et cetera, to people. It'll also give people access to our daily email blasts that we've been doing since the pandemic started, and those have been full of information about what's happening in terms of the most current research around the pandemic. We work with a public health nurse named Elaine Abrams, who has been giving us information to be able to share with our community things for people to do during lockdown, access to different websites, different activities, and also to keep people up on what we're doing every day, given that how we deliver service has changed. The fact that we deliver service has not changed. And we're here 5 days a week answering the phones. We're running support groups. We now have our social and cultural events online. We have our educational offerings up online. And we get daily emails out to, daily phone calls out every day to people who need support. So it will also give registrants access to that information if they haven't been connected to us before.
That's awesome. That's great. Well, thank you so much for all you do for our community, and look forward to chatting with you soon.
Thanks, Kate.
thanks, Kate.
Bye-bye.